Hey guys, today we're going to talk about kidney stones. A lot of fun. Actually, more common than you actually would think. Seems to be about 200,000 reported cases each year, and the strange thing is 11% of men will get them. 9% of all women will get them. So it's not just the men who are getting the kidney stones, it can be women as well. And generally in women, it is a lot more painful. They can be anywhere from the size of a grain of sand up to a bigger one, like around a pearl, which they would have to go in and surgically remove or break it down to smaller pieces so then you could then pass it. Symptoms of the kidney stone are frequent urination, painful urination, it being hard to urinate, like you're trying to pee but you can't get past what's in there, which is the stone. Also, foul odor in your urine, that's something. Blood in the urine can be another symptom. Pain in your back, in your sides, below the rib cage. And in men, that pain can go into the scrotum and to the testicles. You can experience in larger cases, or if you just are having a bad reaction to the stone, fever, chills, nausea, vomiting can all be seen with that. Now, what's important to realize is there are a lot of different conditions that are way more serious than a kidney stone that have these same similar symptoms and signs that I just described. So if you're getting those things that I mentioned, go see your provider right away, because if it is more serious, we want to catch that too. The earlier the better. Something that's kind of funny is the size of the stone is not indicative of the pain. So you can have somebody just literally screaming out in pain, can't pee, just bent over, having all kinds of difficulty, and the stone might be the size of a grain of sand, where the guy or gal that's having moderate symptoms, not that much issue, has a bigger stone that they actually have to go in and quote unquote zap to break down, so then you can pass it by peeing it out. So that is not indicative of it. Now, as far as being prone to stones, who's prone to them? How do we get them? There is a genetic component. If your direct family members have had kidney stones, you're more than likely going to also be a candidate for getting kidney stones. Part of it could be the actual size of your ureter, which is where it passes through, the urine passes out of. But along with that, it may be dietary habits that you've developed from mom and dad and family members. A diet high in red meats and shellfish is going to increase the uric acid, which can cause stones. Also, a diet rich in spinach, which is normally good for you, but it can cause kidney stones. Rhubarb, bran, if you're eating a lot of bran cereal, whole grain bread, you can be more prone to it. If you eat a lot of salt, the sodium can cause stones in it as well. Now, I know there's a lot of things on the internet, and what I did find, dairy, they said, oh, dairy causes kidney stones. Absolutely, it does not. In fact, dairy can help you actually dissolve the oxalate, which can cause kidney stones. Dairy helps break that down, make it easier to pass out. So that is not true. Dairy is actually good for you if you're a candidate for kidney stones. Obesity will make you more prone to it. If you have gout or a family history of gout, you're going to be more prone to it because your uric acid levels are higher. If you have diabetes, you're going to be more prone to it because of issues with your kidneys. Hyperparathyroidism increases your calcium levels. That's going to make you more prone to having kidney stones, because calcium is one of the minerals that can build up in the system to cause kidney stones. If you're not drinking enough water, if you get dehydrated easily, that's going to cause kidney stones, because the more fluid you take in, the easier it is to pass these minerals out. When your urine gets concentrated in these minerals, the calcium, the sodium, the oxalate, the uric acid, that's where you're going to be more prone to having the minerals get together, form the stones that you can't pass out. So make sure you're drinking a lot of fluid, especially water. Certain medications, Cipro for an antibiotic, sulfa antibiotics like Bactrim DS or sulfamethoxazole trimethoprim, HIV medications, and diuretics. Those will make you more prone to having kidney stones. Diuretics are another word for water pill. The exception is the thiazide diuretics. So diuretics like hydrochlorothiazide, metolazone, chlorthalidone are some examples. Those will not make you prone to having kidney stones. They actually go the other way. As far as treatment, there are basically three types. The main treatment you're going to see is the wait and see. On that situation, your doctor's going to send you home, drink a lot of fluids. He may give you or she may give you a strainer. Kind of uncomfortable, but it is important that you catch that stone because they want to see what that stone's made up of to help you avoid future occurrences of the stone. Okay? They also want to make sure that you do indeed pass the stone. So they'll send you home with over-the-counter, you can take ibuprofen, naproxen, Tylenol, as well as, like I said, a lot of fluid, a lot of liquid in general, mainly water. They may give you a prescription for either nifedipine, normally a heart medication, but in this case, they use it to relax the ureter where you're passing the stone through. Flomax or tamsulosin, they will give you a higher dose of it, generally 0.8 milligrams, which is 2 capsules of a normal 1 capsule dose, okay? Again, that's to relax the ureter so you can pass the stone. Be aware, with that higher dose, you're going to be more prone to dizziness. You need to slowly sit down, slowly stand up, because the blood will rush away from your head and you will pass out. You'll faint. So be aware of that. If it doesn't work, they may actually go in and do sound wave treatment to break that stone up to make it easier to pass. They can go in as well if the stone is too big and you're in a lot of pain, if there's a lot of bleeding involved, and surgically remove the stone to get you out of that situation. Not the most ideal, but doggone it, if you've ever had a kidney stone, you'll do anything to get it passed, and that may be the best option for you. Like I said, it's very important to keep that stone for analysis to take back into the provider so that they can see what actually it's made up of to help prevent future occurrences, because you can get kidney stones more than once in your lifetime.